Yeah, Deepak, please unmute.
Okay. Now it's coming from video ఉందా
వీడియో వస్తుందండి.
ఇప్పుడు ఎప్పుడు చేశాను రావట్లేదా సౌండ్? హలో హలో మీరు పని చేస్తున్నారు దీంట్లో? ఒక నిమిషం సార్, ఒక నిమిషం. ఎక్కడ
వచ్చింది.
ఓకే, ఇప్పుడు మైక్ పెడితే అది
ఇప్పుడు ఇది కట్ చేస్తుంది వాయిస్
వస్తుందా? హలో సార్,
నౌ వి ఆర్ ఆన్ స్క్రీన్.
ఓకే, మా సౌండ్ వస్తుందా సార్?
మీరు వీడియో కూడా ఆన్లో పెట్టండి.
వీడియో
ఆఫ్లో ఉంచండి.
ఇప్పుడు వచ్చిందా? హలో,
మీరు వీడియో ఆఫ్లో పెట్టారు చూడండి.
ఆన్లో ఉంది సార్.
యా, నౌ ఇట్స్ ఓకే, ఫైన్.
ఓకే సార్, అది నిన్న మనం ఏదో చేసి చెప్పానుగా, అది ఎలా చేయాలని
నాట్ నౌ, ఆఫ్టర్ షేర్ స్క్రీన్. నాట్
ఓకే, ఆఫ్టర్ షేర్.
యా, షేర్ స్క్రీన్.
ఓకే, ఇది షేరింగ్
చూడండి ఒకసారి.
ఏంటి?
మీ వీడియో వస్తూ పోతుంది, మీరు ఆపేస్తారా?
కాదు, ఇది షేరింగ్ స్క్రీన్ చేస్తే ఆపుతుంది. అది అర్థం కాలేదు.
ఇప్పుడేమో షేర్ స్క్రీన్ ఇప్పుడేం అవసరం లేదండి. జస్ట్ మీది నేను షేర్ స్క్రీన్ చేస్తాను. మీకు లెట్ పార్టిసిపెంట్స్ విల్ జాయిన్.
ఓకే 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 షూర్ సార్. సో ఇది బ్రౌజర్ లో పెట్టాను, సరేనా?
పడేన్
బ్రౌజర్ లో పెట్టాను, బ్రౌజర్.
అంతే.
ఓకే, ఎందుకు యాప్ లో లేదు, బ్రౌజర్ లో.
డైరెక్ట్ బ్రౌజర్ నుంచి వచ్చేస్తుంది మీకు ఆటోమేటిక్. పార్టిసిపెంట్ ఎనేబుల్ చేస్తున్నాను.
ఓకే ఓకే సార్, ఓకే.
యూ విల్ జాయిన్. మీకు యూట్యూబ్ లింక్ పంపించాను చూడండి. Deepak, I have sent you link. Please forward to your friends.
ఎక్కడ
Check in your WhatsApp.
రాలేదు సార్ యూట్యూబ్ లింక్.
Yeah. Send you your WhatsApp. Please check in your WhatsApp and forward to your friends.
ఓకే వాట్సాప్ అది ఆల్రెడీ ఓకే
Forward to your friends.
Good morning, NVR sir.
Sir, good morning, sir.
Good morning, sir.
గుడ్ మార్నింగ్.
Good morning, today's speaker, sir.
I is Dr. Deepak from Pune, sir.
Sir. Welcome, sir. Welcome, sir.
థ్యాంక్ యూ సార్, థ్యాంక్ యూ సో మచ్. హలో సార్, గుడ్ మార్నింగ్.
Hello, sir. How are you?
ఫైన్ సార్, హౌ ఆర్ యూ?
Fine, sir. I am fine.
ఎస్, అందరూ జాయిన్ చేస్తున్నారా ఏమో?
He is my professor, Dr. Rajnikant.
ఓకే ఓకే ఓకే.
I am from Department of Pharmaceutical Analysis, sir.
ఓ గ్రేట్ సార్.
Welcome, sir.
థ్యాంక్ యూ ఫర్ జాయినింగ్ సార్.
Thank you, sir. Thank you. Welcome, sir.
Today we are giving direct Zoom link, sir. The participant can directly can interact with the speaker.
ఓకే. आपण समोर
So more than 41 participants joined. So we can start, sir.
Yes, sir, sure, we can.
Very good morning to one and all. This is Dr. Anvira Amara, Associate Professor at the Department of Pharmaceutical Sciences. I would like to welcome all participants to the webinar on clinical pharmacist role in healthcare system. Our students, our participants are very fortunate to have Zoom Pro, have continuous education providing by Dr. Professor Ramarao Nadenla, Principal, University of Pharmaceutical Sciences, and management Sri Vaivanyan Garu has provided the Zoom Pro to having such an opportunity to continue the education. Today is our experienced speaker, pharmacy, has been providing a lot of services to various corporate hospitals. I'm going to read his profile. Dr. Deepak D. Borambe, Senior Executive Clinical Pharmacologist, has been working in LH Irandirani Hospital, Mumbai, Maharashtra. Sir is now currently working in clinical pharmacologist, Yadri Super Specialty Hospital, Pune. Sir has served more in LH Irandri Hospital, Mumbai, Maharashtra. Dr. Deepak is an intellectual, renowned researcher and innovator person who always strives for the professional growth with his skills, hard work, and competency, sir. Sir started his career and trainee research associate, ICBIO, Clinical Private Limited. A step ahead into pharmaceutical services as a hospital pharmacist, after as a clinical pharmacist in Rural Development Trust Hospital, and as a clinical pharmacist in Aditya Birla Memorial Hospital, Fortis, Mumbai. Sir is currently working in Sahyadri Super Specialty Hospital, Pune. Sir has served as a membership for Asian Consortium member of Association of Community Pharmacists of India, member of DT Patient Safety Committee and Anti-Measure Advisory Committee. Sir carried out various research projects in area of epidemiology and published various national international journals. Sir delivered lectures at various prestigious institutions and organized various national international conferences. Sir pursued Bachelor of Pharmacy from University of Pune, Doctor of Pharmacy, JNTU, Hyderabad, Anandapur, JNTU, Kakinada, Anandapur. Postgrad Diploma in Clinical Research, Pharmacovigilance from ICBIO Clinical Research, Private Limited. Sir, we are welcoming you, sir. Dr. Deepak, sir.
Yes. Thank you, sir. Thank you so much.
So, by sharing your PPT, you can continue the session. Please share your PPT and continue your session, sir.
Sir, it's not connecting. Sharing option is not there. Everyone is visible? Hello?
Sir, it is visible, sir.
Hello?
You are audible, sir. Share your screen.
Screen I am sharing, but it's showing the message from your end.
It's not visible.
So it's not able to. I'm just connecting it. Hello? Hello everyone. Hello? Sir, my screen is on.
Yes, sir. We can see your screen, sir. Yeah.
Yeah. So my PPT is there. Everyone is getting visible.
Yes, sir. It is visible. You just magnify the PPT, sir.
Yes. I am doing that.
Yeah.
Yeah. First of all, I am thankful to Chalapati Institute of Pharmaceutical Education Research Center, who will give me the opportunity to give the webinar on this virtual digital platform. And I'm not taking a much time to go with the other factors which will comes in the practice and all things. We are directly moving to our session, which is the role of clinical pharmacist and healthcare system. So on the we are looking for the healthcare system where which are the people are working in healthcare. Okay, so as obviously we are watching, there is a compose of physician including other medical and dental staff, pharmacists, nurse and other paramedics. So in the physician diagnose, we will do the diagnosis, we will write the prescription, we will monitor the patient, we will do the medical care. Is coming as a
So,
pharmacist who will do. Hello.
yeah, participant, please unmute your mic. So it's getting disturbed. Participants, I'm requesting to please unmute your mic. It's interrupting to the speaker. Okay, thank you. Go ahead, sir.
Yeah. As a pharmacist will do the prescriptions, also just reviewing the prescription, dispensing the medication, counseling the patient, monitoring and pharmaceutical care. Here is the role I am saying that a pharmacist, not a clinical pharmacist in the healthcare system. Nurse is a main role in the healthcare system as administering the drug, monitoring and nursing care. And there is other people also there, that is we call other paramedics. That is the biomedical care, rehabilitatory care, physiotherapists, dietitians and all. But where is the clinical pharmacist? That is the main thing. So we are, everyone knows that we are introduced by Doctor of Pharmacy course in the community or in the government sector everywhere, but still we are where? That is the big questions coming in our mind. So where we are coming, so we want to concentrate how we are keeping a efforts to uh, actually propounding our role in the healthcare, proposing our role in the healthcare system. So yes, there is a workload could be attributed to physician and nurse and to be very high due to the system. Like physicians are in the hospital for the treatment of patient with the help of nurse. Where is the pharmacist and where is the clinical pharmacist? As we will say, we are not a pharmacist, we are a clinical pharmacist and we are highly qualified, and that there is a lot of things are there in, as a pharmacy students or in the healthcare. We are just in the very bad impression that what is the role, your role. Even we are going to the new organization or even we are going to the anywhere in the healthcare system or in community or in front of government, they will say where you are. So this is the main role where we want to introduce ourselves in the healthcare system. See, the today's session is not just only I am telling you the role of clinical pharmacist healthcare system, but I will give you the total importance, what we want to do and what we want to keep in front of the community, government and healthcare system, that they will know us. Yes, PharmD or Doctor of Pharmacy or the clinical pharmacist is the most important role in the healthcare system. Okay, and this is a, I in the my current slide I will told you about the general healthcare system where the patients or the community knows these are the peoples in the healthcare. Other than that, no one. Okay. Then, as we go into the clinical pharmacy, yes, everyone knows that clinical pharmacy is the science and the practice of the rational use of medication, where the clinical pharmacists are more oriented towards the patient care, rationalizing medication therapy, promoting health and wellness of the people. This is a generalized, or we can say, is a clinical pharmacy first definition. But today, on the day of 2020, we can say it's really modern clinical pharmacy services, because we are introduced in the India 2008 and now we are completed total 12 years in the clinical sectors. We are giving different services that will look into the next slide. But the second definition, which will given by the American College of Clinical Pharmacy, and they have started the clinical pharmacy services in 1969, where is the 40 years, 50 years back. So that time they are in
Hello.
the first. Hello. Hello, are you audible?
Yes, it's audible.
Yes. So the definition is it is a modern and extended field of pharmacy, the disciplines that embodies the application and development by clinical pharmacists of a scientific principle of pharmacology, toxicology, therapeutics, clinical pharmacokinetics, pharmacoeconomics, pharmacogenomics, and other allied sciences for the care of patients. This is the actual definition as we look into our PharmD curriculum. These all subjects we are learning in our PharmD curriculum. Even the MD pharmacologist also not learning these things very thoroughly. We are the specialized persons who will learn these all things thoroughly for the 6 years of Doctor of Pharmacy, and we are known as a clinical pharmacist or clinical pharmacologist. Depends by the organization's rules. Okay, we'll go into the next, where first we want to know about the history, how we are introduced and what is the level now we are in the community. So until the 1916, there is a traditional rules. There is a no rule for the any difference between the clinical pharmacist or pharmacist or dispensing pharmacist, hospital pharmacist. There is a traditional rule. There is a people who know the Ayurvedic things. They will come and they will tell to the shopkeeper, give me this thing. That is a rule. But after that, USA is thought that is the first country. We thought that we want to start the clinical services because of some of tragedies that happened, and WHO took a decision and collaboration with the American countries who will started the new designations which is called as PharmD degree. And in that PharmD, the developments include the practice of pharmacy in UK also started in the then rather than increasing pharmacy practice in the hospital wards, then the next degree also came master degree program in the clinical pharmacy. This is I am saying about the Western countries, not in the Indian country. Okay, so it will started clinical pharmacy after 1960 to 1976. We are introduced first time as a clinical pharmacy services. The progress of clinical pharmacy development remained in the low profile in the first decade of the see. There is a devil took 1976 to 1986, total 10 years. Okay, to progression of clinical pharmacy in the US and UK countries, and we are in the 12 years of now. We are also want to keep a lot of efforts to introduce ourselves in the healthcare system or in the all sectors, because we have exposure in the all over sectors, not only the stipulated in the healthcare sector. We will go forward and we will see what is the different sectors where we can get involved. But is the fact, until today clinical pharmacist is in embryonic stage in the India. This is the current situation in India. Why? That everyone knows why we are in that, because there is a thing with what is the pharmacy students also saying and what is the healthcare is also thinking, and what about the government also, they will think differently. Okay, I will not go with the what is happening in the current scenario in the governments and the other sectors, but I want to concentrate on the session which is role of clinical pharmacist. There is a lot of things we will discuss one by one after the sessions. Okay, so first, that after the clinical pharmacy introductions, we'll go how clinical pharmacy differ from the pharmacy. Yes, our basic is the pharmacy. We will not other than the pharmacy. As we can say, we are a clinical pharmacist, we are a clinical pharmacologist, but our birthplace is the pharmacy. That is the basic of pharmacy. Okay, so in that we are learning a lot of subject. But yes, there is a difference from the pharmacy to clinical pharmacy, is that pharmacy in the diploma of pharmacy, bachelor of pharmacy, master of pharmacy, till that you are learning a pharmaceutical companies oriented education or syllabus. And in the PharmD, from first year to 6th year, you are learning total clinical sector, total healthcare system, total disease management and everything, clinical trials, research and everything. This is the big difference in clinical pharmacy and bachelor's, master and diploma pharmacy, other pharmacy fields, where as you can look into the B pharmacy first year to 4th year, you are learning totally industrial orientations. There is a not have any clinical orientation. Yes, you have a pharmacology subject, you have a biopharmaceutic subject, but it's total industrial oriented. It's not related to your clinical sector. Okay, in diploma, that is a very basic diploma of pharmacy where they are just learning an overview of pharmacy services. Okay, but as we are going to M.Pharm, there is a master of pharmacy who will learn the trials, research and development sector. He will do the trials, he will introduce, he will do a synthesis, he will introduce a new thesis of new drugs and lot of things. But in the clinical pharmacy or the PharmD curriculum, first year to 6th year, you are learning totally clinical things, where you are directly contact with the patient for the drug therapy management. There is, I will give the analysis of population needs to regard the medicine, ways to administration, pattern of use, drug effects of patient, overall drug management therapy, and to find first to find the drug related problem, then come into the drug therapy management. Yes. Then the focus of the attention moves from the drug and single patient to the population receiving drugs. So it's not the care for the one patient, it's a care for the all patients. And in India, we are getting an exposure of all specialties. Now, in the after 12 years of introducing PharmD also, we are not just stipulated with the one specialization. We are looking for the all patients, nephro, cardio, neuro, all surgical, internal medicine, gynec, pediatrics. We are getting a whole exposure in India. Western countries there is a specialization also. We can do a specialization. We are very more specialized in that field. Like as we can say in the Kerala, Amrita College, PhD in Coimbatore, or on that side means in the south uh, south region, where is the clinical pharmacist involved in the specialized services. Why? Because they kept their efforts to learn that field. They kept efforts to give their total experience in that specialized field, like neurology clinical pharmacist, like cardiology clinical pharmacist. Why? Because they introduce themselves in with the physicians. That's why they get approvals to do a practice in this specialized field. Okay, and that's only the things we want to be incorporate in our practice on daily basis. Okay. The next, yes, clinical pharmacists have some requirements. They must want to know about the everything, like for patient care, everything they want to know for patient care. Keep this point in your mind. Everything is for patient care, and clinical pharmacy is coming under the value added service in the healthcare system. If we are doing this all processes very thoroughly, very clearly, so we will give a total back support to the healthcare system, and that will most important in the current scenario in the healthcare system or in the community. Okay, on day by day basis there is a lot of infections are increases. Like now currently you will look in the pandemic coronavirus is very affecting to all our countries. So like that lot of things are there is going on in the world in related to infection diseases, and it's related to mortalities. Okay, so in that our major role is now came in front of the healthcare system. But in that we must want to know about knowledge of drug therapy, knowledge of disease, knowledge of laboratory and diagnostic skills, knowledge on communication skills, knowledge on patient caring skills, physical physical drug information skills, therapeutic planning skills, and knowledge of non-drug therapy skills. Okay, so in non-drug therapy, as we can say, counseling skills, therapeutic planning skills, as we can say, is the drug-drug interactions, food-drug interactions, adverse drug events, and to manage the therapy. It's not just a skill that you want to develop by your basic practice in the pharmacology or basic practice in the pharmacotherapy, but it's coming by your daily practice on the case studies. Drug information skills, yes, this is the most important value added service in the healthcare system that we want to introduce all over, because we are the persons in the healthcare system who knows the drug related problems, who knows the drug adverse event, who knows the mechanisms and everything. Okay, yes, there is a physician, yes, there is a doctors. We don't want to cross to them because they are in the prime, we are in the second. But yes, we don't want to see us in lack in the drug related services, because if you have knowledge, if you have you can keep your total efforts to show your talent or show your experience in the drug related things, drug related problems or drug therapeutic management. So doctors also accept us because doctors are total specialization is in the diagnostic field, not in the drug related drug therapy field. Okay, so they know, they are more skilled person in the diagnostic techniques. They know the diagnosis, they know the evaluations, care, critical care, and all things. But they are very some experience. Yes, they are good in the pharmacology also. They are good in the therapy also. But yes, they also want to accept that they are not much in the therapy or pharmacotherapy related skills. That is only in hand of clinical pharmacist or in hand of the masters in the clinical services personals. Okay, then we are going to the sharing skills. Yes, physiological skills also there. We want to counsel the patients related to their physical exercises and daily lifestyle modification, quality of life, and everything. Then patient sharing skills. Yes, when we are going to the counseling, there is the most important thing, patient caring, because patient caring is the prime in the healthcare, where we are going, but we are not introducing ourselves. We are directly just following the rules, whatever the organization saying. First, there is a criteria. As you can look into our clinical pharmacy book that is written by PHARMACIST sir, introduced, and in that patient sharing skills are there. So that caring skills where you have to be utilized, that is your practice. Communication skills, yes, most important. Knowledge on the laboratory and diagnostic skills, and knowledge on disease and the knowledge on drug therapy. Knowledge on laboratory and diagnostic skills is in the our therapeutic subjects or in our total curriculum. We are saying yes, we know everything, but we are not keep that in our practice. That is our lack. There is a normal values also we don't know. So as a family person, as I can say, they are coming in the healthcare system as a clinical pharmacist. They must want to know about laboratory and diagnostic skills. And there is a doctors also. If you don't know, you can ask to the doctor, you can ask to the your colleagues who are the doctors, sir, I don't know, please tell me. Learn that thing. That is the most important. If you are not learning, you can't grow and you can't update your knowledge in the case studies. Okay, knowledge on disease, yes, we have a knowledge on disease because 6 years we are learning all diseases. But in the practice, it's not just requirement of knowledge of one disease. There is a multiple complications patients coming in the hospital, and that time you can't say the single disease related therapy. There you want to think about all over disease related therapies, and then you want to give a best drug therapy to that patient. Okay, then
Deepak
level of,
sir, please start video.
yes sir.
Your video is not coming. Your video is
Okay,
not coming.
yes,
Yeah,
yes.
now it's fine. Now it's fine. Go ahead.
Okay, so there is a level of action of clinical pharmacist. So in the healthcare system, there is some levels of clinical pharmacies, that is pharmacy activities may influence the correct use of medicine in the three different levels: before prescription, during, and after prescriptions. Why I am telling you this all things, there is not just as a lot of people is looking at the clinical pharmacy, a lot of conferences they are attending, services, because we are new and we want to keep in updated things. Here I am talking related to slide because I want to show you where we are, and I am sharing you the my practice, whatever I learned from my last 5 years of experience. So where we are lack and how we want to be updated in the system. Okay, so if before the prescription, yes, there is clinical trials, there is a formularies, there is drug information and drug related problems where we are. So in the clinical trials, as a yes, on daily basis, when you are doing a case study, there you are doing a case study with clinical trials, because there is a lot of cases, interesting cases, as we look into the ICU setting, critical care settings, or and everywhere. So in that, our role, don't think on clinical trials in the only the happening in the clinical researches. It's happening in only in the CROs or in the pharmaceutical industry. But yes, before the prescription, yes, there is a clinical trial happening in the healthcare system. As you are keeping your efforts, as you are understanding the thing, as you are keeping your knowledge to understand, then you can daily do a trials that we can post market surveillance phase trials. Okay, in that how, so before the prescription, if prescription is coming in your hand, that is a past medication history of that patient, and patient know is that patient came to the hospital just because of medications, just because of came to the hospital for medication. So that is a trial, because patients will may be affected, maybe got adverse event, maybe got drug interaction, maybe got food interactions or something else. That's the one thing. so that you want to understand. And here is post marketing surveillance coming, because if you don't know, we are reporting adverse reaction to the PPI. Okay, pharmacological program in India. So this is area you want to be understand how patients come to the hospital. There is a adverse drug event also, and there is adverse drug reactions also. Some patients are continuous on the medications, but they are not taking that medication on time. That is the thing will happen and will come to the hospital. By within a week, within a month, within a 2 months, they are coming back to back in the hospital admissions. So where you want to understand why we are coming out. Yes, there is a formulary development in the pharmacy sector. Very most important with the gathering of the all clinical doctors, head of the doctors, and we have to develop a formulary with doctors to keep in mind efficacy and safety for the patient care. There is not that just I want this brand, I want that brand, I want this. There is a lot of things are happening in the healthcare system, but you want to be more concentrate on patient care. What is my patient require that I want to give? Formulary you want to define like that. It's not just what is doctor is saying, I want this, give that. No. My concentration is patient care. Patient cost effectiveness, which we are learning in pharmacoepidemiology. Okay, cost effectiveness, cost benefits for the patients. Yes, that is the prime thing. Drug information. Yes, when patient coming to the hospital, we want to provide a drug information to the patient. Or else, if we are not provided, what is happened? And patient came back to the hospital. That is the prime thing. That's why when counseling or drug information, we want to start. Drug related policies. There is a lot of drug related policies. As you know, we are in healthcare system. There is a NUH accreditation. What is we can say GCI accreditation. This is all the accreditations for the healthcare system. And yes, lot of organizations are looking clinical pharmacists as a mandatory thing for NUH and JCI. Are we? No. We are not just for the accreditation purpose. Okay, and who are the organizations are saying this thing? You can do just only documentary work and you are just utilize your in the accreditation system, then you are the lack in that. You are not keeping your efforts, you are not keeping your talent in the system to tell to the system that we are not for this thing. We are not for accreditations. We are for the patient care, for value-added services, back supports of the consultants or physicians. Not only back supports, we are saving the medico-legal cases for organizations also. We are saving to consultant. Actually, we are saying we are back support, but we are in the front. As you can see in the Western countries, we are in the front, then only consultants. Because therapy is most important, where anything can happen. We will see in the next slide. Next is during the prescription. Yes, during the prescription, as we are following our, I don't know, I am following these things as per my level. Counseling activities. Yes, you want to be maintain your counseling activities with the patients, with the patient caregiver, with the consultants, with the healthcare, any healthcare worker. You want to provide a counseling related to drug therapies, as you know the disease conditions, related to disease condition, and here you want to be introduce yourself. That is the most important. You want to introduce yourself. Other than that, is nothing in our hand. If you are not introducing, first community or patient just understand, yes, someone is a doctor. Yeah, we are a doctor. As we can say, we are a doctor, but we are not diagnostic doctor. We want to introduce ourselves. I am a clinical pharmac or clinical pharmacist. If they will ask what is this, you can say I am disqualified. Automatically your introductions or your acknowledgement or your recognition will happen. Most important things to keep in mind. Clinical pharmacists can use attitude and priority to prescribers in their choice of contract treatments. Once understand during the prescriptions. There is a some doctors are writing same prescriptions day by day basis. Okay, because the same conditions. Okay, he will get internal medicine. Now in the current scenario, there is a LRTI, there is a corona patient. There is no change in their treatments. They want same treatments, but patient to patient there is a different clinical evaluation is required. Okay, so I'm not saying that doctors are not doing that. Yes, doctors are doing. I'm really more happy with the doctors because they are doing proper practices. Why we are not doing that? We want to keep ourselves in their place related to drug therapies. That is attitude we want to be developed in our practice, because prescriber is doing their treatment, he is giving, but we are not there. We are not looking the prescriptions. We are not looking the prescriber besides. Okay, we want to be thorough with that, and we want to be sit with the prescriber. Even in front of him, any patient is coming with the some comorbidities, anything, we want to advise or we want to suggest to the prescriber, sir, kindly give this thing. Okay, if you are understanding things, and learn from the physicians or consultants, because they are teaching us a lot of things, and they are learning from us related to pharmacotherapy also, giving and taking our just give something, take something, as you are keeping in mind. No, yeah, they are just saying the thing, they are teaching me continuously, but they are not understanding, they are not hearing me. Why they are not hearing? Because you are not tackling your problem properly, because of you are not going to suggest or advise to them. You are just going in the mind of what I am saying, that is correct. Please don't keep that attitude. If you are keeping that attitude, no one can accept you. Okay, next is the clinical pharmacist monitor, detect, the prevent medication related problems. Yes, I already said the clinical pharmacist pays special attention dosage of drugs we need to therapeutic monitoring and prescribing decision. They also monitor the okay, next is the clinical pharmacist monitor, detect, the prevent medication related problems. Yes, I already said the clinical pharmacist pays special attention dosage of drugs we need to therapeutic.
Yeah, yeah. Yeah, it's fine. It's fine. Yeah, yeah. It's feel that. Yeah, yeah. Yeah. Hello, participants. Am I audible? Hello.
Yes, sir, it's audible.
Yes, sir.
Yeah, just Deepak sir has lost his power, so he will join shortly.
Okay, sir.
So thing is that I hope you are understanding such a means such a family guy is working in such a corporate hospital. How he is confidently telling what way you have to showcase ourselves as a physician. Hello.
Yes, sir, we are understanding.
So that's why you take so many questions and you can interact with the Deepak sir. So he's a person has a lot of experience. He worked in one of the top corporate hospital in India. Like Fortis is one of the top 10 hospital in India. So he trained our students. So more than 5-6 members worked in Mumbai also. So as an internship, he has given opportunity for our students for 3 months. Means even our students also has found some drug interactions and ADRs and drug updates. So like that, they have awarded by the Fortis Hospital higher authority has awarded our students. So finding some areas, finding drug interactions, finding means those updates. So Sucharita has got awarded. You can see in our college also. So that's what the way such people can build your confidence more and more, where you can work in public sector as private sector, where you can showcase yourself. That's what I would like to ask you, that please interact more and more. You will join. So what you understand so far, please unmute your mic and interact. Mohana, Gopi. Hello, am I audible?
Sir, you are audible, sir.
What you understand, Gopi?
Initially, the history and the differences between the clinical pharmacist, hospital pharmacist, and D
Now
farm.
he's earning more than, I think, more than 60,000 with having around 4 years experience. That is the way he performed. Show means the way he performed in hospital and showcasing it himself. Understand?
Yes, sir.
Still upgrading data and upgrading knowledge and drug updates and following ward rounds. So you can imagine such a personality, the short span of time, how he's engaging with the corporate hospitals and communicating. Means even the short span of time, usually will stick with the one location of job, but he shifted to 2-3 hospitals. You can imagine what knowledge they are taking. Means such a personalities taking the knowledge into the practice. Is it okay, Deepak? Yeah, Deepak. Yeah, you can.
Hello.
Yeah, it's fine.
Sir, I am audible.
Yeah, it's audible. You can go ahead.
Okay. Sorry for disturbance to everyone. Sorry for disturbance for everyone. We'll take a just there is a problem. We'll go forward. Yes, I am on the community pharmacist can also make a prescription decision directly where over the counter drugs are counted. Here in the community setup, we are not much involved. But as a clinical pharmacist, as a serviceman, as a lot of our colleagues or juniors are saying that, yeah, what is the work in the healthcare system, work in the community pharmacist? But I will say you, if you are starting with community, you will recognize yourself to all over. Understand it? We are recognized to all over because just not hello.
Yeah, tell me, sir.
Yeah, okay. So we are recognized to be all over. That is the most important thing because in the community where you are opening your shop, not just a dispensing pharmacy shop, where you want to be you counseling over the counter prescription. Yes, in my curriculum, I am giving counseling to the patients over the counter in the pharmacy also. And where each of the patients are connected me in my this 5 years of practice span. They all are till date they are connected to me. Even they are going to their doctors, they are saying that we want to talk with Dr. Deepak. Okay, there is my past 2 organizations where I done this thing, and till date they are calling me and asking me this a lot of therapy related problems or therapies and all things. Even I left the organizations also, but it's my prime respect or it's my prime responsibility to give them a proper therapy. Okay, so that is the things you want to develop in community. You can develop that all things in your practice. Okay, you can connect a lot of patients with you and you can move forward with that for this pharmacotherapy management and medication optimization
Deepak, sir,
services. That is
please,
most important in current scenarios.
Deepak, sir, please take out the headphones and
Yes, sir. Yes, sir.
some voice disturbance is coming. Voice is not clear.
Okay.
Please, without the headphones, you
Yes,
directly
yes, yes.
communicate.
Now it's coming, sir.
Yeah, it's coming. It's coming.
Okay. Now we are going to the next. There is the medication related problems. This is during the prescription. Now it's in the healthcare system. Okay. So in the healthcare system, yes, there is a untreated conditions. There is a improper drug selection, subtherapeutic dosage, medications failure to receive, medication overdosage. adverse drug reaction, drug interactions, and medication use without indications. If you know that how to do a case study and how to do a ward rounds, okay? So when you are going for the ward rounds, what you are looking, it's not just a pharmacist, clinical pharmacist or pharmacy candidate or anyone in the clinical expertise who will go for the round and just look the file for the therapy management or just for the their related work. But as you are looking in the file, you want to look this all things. Okay, then only case evaluations will happen. In our curriculum, we are learning a SOAP analysis, form analysis. What is that? It's not just go and take one file and just write it in the form and come and just present it. If you understand or not understand. But it's the most important thing that you need to understand what is that case. In that case, any untreated indications are there? Is there any drug related reactions are happening? Because patients is coming with multiple complications. Okay, in multiple complications, there is a lot of preferences. There is not only one consultant look at patient. There is a lot of different specialized field doctors will see. For example, if patient is coming for the diabetes mellitus with chronic kidney failure, with liver cirrhosis, with something, there is a multiple complication. So in that case, there is a multiple specialized consultant physicians also there involved. And in that level, there is everyone is coming and everyone is giving their own opinions in the therapy related to his clinical findings or clinical evaluation. So that's only you want to understand. So here you are coming in the loop. Here you want to understand what is the therapy because every doc consultant is coming and where here you can identify which is the untreated indication, which is the drug related problem, which is the subtherapeutic dosage, and where is the failure. If every condition there is a stipulated time frame where the patient can get cured. If he is worsened just because of clinical condition or he is worsened because of medication related things. So medication related things, so there is a clinical pharmacologist, clinical pharmacist who will look into that. But are we introduced like that? This is the question for you all, or for me also. Are we introduce ourselves like that? If yes, then no one stop you to do that. If no, then keep efforts to grow your knowledge, to keep your skills increasing. Hello? Hello?
Sir, yeah, it's audible. But this
Okay.
voice is coming, sir. Voice disturbance is coming. So have you used any other device? Please remove your. Are you charging?
Yes, sir, charging is there.
So
Now,
just you remove the charging,
now,
then I can check your voice.
now is audible, sir?
It's audible. So voice is breaking. Voice is audible, but voice is breaking. I don't know what exactly.
Just a minute. Just a minute, sir. Just a minute.
It's double voice is coming.
Just a minute. Just a minute. I will just make it possible. Sorry for disturbance to everyone.
No, are you using two audio, sir? Is it coming double voice? Hello. Go ahead, sir. Go ahead. It's not a problem. Go ahead. In YouTube, it's coming very clearly, but in the Zoom, it's not coming clearly. Go ahead, sir. Deepak, sir.
I am really sorry, sir, for connecting. I am connected now. There is no disturbances now. Forward.
Yeah. Yeah, okay, no problem.
Just I want to share my screen. 1 minute. Okay, now everyone audible?
Yeah, it's audible.
Okay, fine. Sorry for everyone. Once
Ah, no
again,
problem.
there is some
It's a
connection
quite
problem.
common.
Yes. Next is the after the prescriptions. Yes, there is a counseling preparation personalized drug application and pharmacoeconomic studies. Yes. Already I told you counseling related things, preparation of personalized formulations, yes, related to the liver functions, liver function failure
Did
patient,
you,
renal
sir,
function
did you
failure
switch
patient.
on the switch off the YouTube? Did you switch on the YouTube live is there? No? Have you turned off that?
Yeah.
YouTube live in your Google Chrome? Have you turned on or turned off? I think it may be the
The
revoice is
Google
coming.
Chrome is on.
Okay. If you turned off that YouTube, it's not a problem. Now it's okay.
Now okay, sir?
Yeah, it's okay. Fine. Go ahead.
Okay. Okay.
Go ahead. It's fine.
So
Interrupting you.
after the prescription, the next is the function of clinical pharmacist. Sir, audible?
Yeah, it's audible. Some murmuring sound is coming. Just without headphones, it will be better. So I'm
Now,
interrupting.
now,
Try to understand.
sorry. Actually, I don't know there is a some there, but we will continue that. There is a functions of clinical pharmacist.
I do one
Hello.
thing. Ami phone is sorry.
Yes, sir. Are you hearing, sir?
Sir, I will do one thing. You call me and your voice I will give you. You call me. You explain by phone and
Hello. Okay, sir. What's up? Hello, sir. Are you audible? Hello.
No, sir.
okay. Now it's audible to everyone. No disturbance.
Okay, thank you so much. So can we go forward?
Yeah, you can go.
It's audible to everyone here?
Yeah.
Sorry for there is a lot of disturbance because of current problems in this Pune city.
Yeah, participant, is it audible? Mahesh? Mahesh? Ramya?
Yes, sir.
Is it audible now, Amma?
Yes, sir.
Okay, you can go ahead.
Okay, there is a functions of clinical pharmacist. As everyone knows, we learn in the healthcare system or in our internships also. In family curriculum, there is a taking of medication history of the patient, patient education, patient care, formulations and management of drug policies, drug information, teaching and training of the medical and paramedic staff. Then the research and development, participation in drug utilization studies, patient counseling, therapeutic drug monitoring, drug interaction surveillance, drug adverse drug reaction reporting, safe use of drugs, disease management cases, and pharmacoeconomics. As we are looking in the functions in clinical pharmacy, yes, we are learning on our daily basis these all things. But how we want to do a practice as a clinical pharmacist, or how you want to keep this all in your practice on your regular round, or as a clinical pharmacist in the healthcare system. So taking the medical history of the patient, there is not just a thing that we want to go to the rounds and we want to take a patient file and to note down everything. That is not just a medical round. It's not a ward round. It's a round where you want to take important related to case studies. What is the clinical condition of patient? What is his complaint? What is his diagnosis? What is his pathological values? What is his diagnostical X-rays, ECGs? There is a lot of different findings are there that you want to look into that. Then you want to go through with past medication therapy. You want to go through with patient eating habits, lifestyle modification. That is most important. Quality of life. What is patient is doing? What is his social history? That everything you want to be gathered or for your decision making or for your therapy management or pharmacotherapy management. After that only you can find the drug related problems. It's not just around to go for the whatever the in academics I will say about academics. There is a PharmD student going for round, just lecturer is saying, I'm taking one file, coming back, presenting that case in front of the all colleagues, and what you're learning in that, I don't know. Because I am also PharmD candidate. When we are presented the case, the same thing will happen. But after the practice of this everything in my total job profile, I learned that everything what I am not learned in my PharmD curriculum. Okay, I will say when you are presenting a case, there is one physician is required if you want to learn a diagnostic technique or you want to understand the case. Okay, but that is not going to happen. Who are the lecturer is there? I will say him, please take care of that. In the case studies, please give knowledge about your therapy management, about your disease management, everything to the student. That is most important thing. Because when student or the PharmD candidate is coming after completion their academics in the healthcare or in the market, when the interviewer asks them the questions, they are not able to give the answer. It's related to clinical things. They want to understand what actually we are learning. That is most important thing that we want to develop in academics. Or the students also take an effort that how they want to take a case. It's not just for the documentation. It's for learning. When your basic is clear, you can go thorough with your responsibilities in the clinical pharmacy services in the everywhere. I'm not saying only healthcare, everywhere. Because that is the basic things you want to learn your academics. And our curriculum is the best curriculum or best academic syllabus in the all over world. If you can say, there is, I think so, in the 2013, our syllabus is based labeled as a Guinness Book Record or some Limca Book Record. There is a best syllabus for PharmD. Okay, so keep that things in mind and we learn like this. Okay, I'm not going through with this because everyone knows about this thing. We are going the next. This is a funny thing where we can say, just read it that it relieves watery eyes, runny nose, itching head, and sketchy throat. And the same thing. Side effects also include runny eyes, watery nose, itching head, and sketchy head. So what is the use of that drug? See, understand by this one speak what is happening in the community. What is your community pharmacist will say? What is the dispensing pharmacist will take a decision over the counter? Patient is confused because he don't know about his therapy. As a cardiologist who will give a medication, he will say everything about the diagnostic. You have a heart problem, you want to take this medication, but he will not explain to the patient related to drugs why he is taking a medication. Okay, that is the work of clinical pharmacist. That you can explain to that patient which is the medication you are taking and what is the importance of that medication. That is the counseling, and that is the drug information that you want to provide to the patient. This is the one step forward that you want to take in front of healthcare. Keep in front of healthcare that we are for that. Understand it. Next is that clinical pharmacy specialties. Yes, this is the most important because a lot of our colleagues, juniors, PharmDians are saying, sir, there is a no scope, sir, there is a no value of clinical pharmacies. There is a healthcare system is not giving a importance to the clinical pharmacies. Why? There is a lot of scope of clinical pharmacies. Just you want to keep updated knowledge in front of everyone. There is an evidence-based practice you want to be keep in front of healthcare system or in front of community. Then only that things are possible. Because government is saying pharmacy practice regulations. Where is the role of pharmacy candidate? Then pharmacy candidate saying, sir, our role is not mentioned in that. Why your role want to mention in that? You want to show the community, you want to show the government why we are important. Then only government will understand how we are specialized and what is the things we can, what is the miracles we can do in the community, what is the miracles we will show to the show for the patient here. But we are doing that question. Okay. Usually requires the residency and specialty rate. Okay. When we are going forward to the next future, next after 5 years or 10 years, yes, there is a happening. There is a specialty residency program, maybe come in the pharmacies also. Like physicians who will do fellowships, specialties and lot of things. Still we don't have that residency program. But in Western countries, they have a specialization. If it's coming in India also, so our value want to increase. But now you have exposure to all over field. So please understand that. Keep your all talent in that and to improve your knowledge in the case studies in every specialty. It will give you a growth in the future aspects for residences and everywhere. Then job functions depends on the specialties and the institution. Okay. Then usually has teaching and research responsibilities. This is the scope of clinical pharmacy. There is a specialties available. Clinical research, IT sector if you are going, there is a research associate, pharmacovigilance associate, drug safety associate. Then even there is a software development also where clinical pharmD candidate or clinical expert will enter. I am an advisor of one of the IT companies where they are developing a software related to clinical services. And this is the IITN. They came to the one of our consultants to ask related to what we can develop, how can we develop our software related to clinical and healthcare. That consultant is referred these people to me. You go to Dr. Deepak, who is the best person who can tell you about the all things. I told him, I guide item, they are developing one software. And now that software will use in the 150 hospital. This is not just a scope, but it's a scope that you can understand by your practice. It's a different thing rather than your clinical practice. But scope is most important, how you can develop your field or your curriculum in the sector. Okay. Next, there is other areas also. Yes, ambulatory care, where is the clinical pharmacy practice is most important. Critical care, most mandatory. Mandatory clinical pharmacists want to do their rounds in the critical care because multiple complications. Critical care team will give medications according to the clinical conditions. But we want to manage their therapy according to pharmacotherapy management. Drug-related problems. There is some medication which will give in same time. Some medication you want to give on the evening time. Some medication want to give the difference between 1 hour or 2 hours. If they are giving on same time, there is ADME. You want to understand the biopharmaceutics, that is biotransformations, and ADME, absorption, distribution, metabolism, and excretion. It's everything you have to understand when you are evaluating critical care files. Drug information already to geriatric long-term care. Yes, geriatric patients, as we can see, there is a most important dosage management is required. Dose management is required. But are we doing? Question mark. Why we are not doing? Consultant is writing the full dose. As we know, there is a creatinine clearance, there is a requirement of patient dose management because his condition or his geriatric condition, which is already said by norms or regulations, there is a dose management is required. But his pharmacy is doing that, his clinical pharmacist is doing that. Is clinical pharmacist allow in the healthcare to do that? Question mark. Why these things are there? Because you are not introduced yourself. You are not kept your effort. You are not kept your knowledge in that. You are not told to the consultant or physician regarding that. You are not told to the healthcare regarding that. You are the specialized for that. You can do that. Are you? If yes, good and fine. If no, start to do practice like this. Internal medicine and subspecialties. See, there is an internal medicine in that your role is most important. Why I can say? See, there is a metabolic clinics are there is a diabetic clinic, there is a coagulation clinic, there is a stroke clinic, there is a lot of clinics are there in internal medicine. Where the most important role for clinical pharmacist to manage everything for that patient related to medication. Are we involved in that? I am involved. Last 3 years onwards, I am involved in these processes. That's why I am saying you want to tell where you are, if you are steps, where you want to be introduced. If you are not doing, start doing this thing. Cardiology. Under me, there is a lot of interns are coming to learn the clinical pharmacy services. There is a lot of other, I am saying RMOs also, DNB students also, they are coming. Even the law, as a difference, I will say in the DNB students or RMOs or in the pharmacies just saying that they are learning a lot of things, but they are not utilizing their knowledge in the practice. My request to all, utilize your knowledge in the practice.
Exactly.
Cardiology, where you are not understanding ECG, you are not understanding echo, you are just learning. What you are learning in your curriculum? That is, you also don't know what you are learning in your curriculum. So how can you keep your steps forward? You are learning everything, just you want to show your way, you want to create your path in front of cardiologists. Yes, sir, I know this thing. As I can ask to my interns, sir, can you tell me about EF? They are not saying anything. They don't know electrophysiology. What is the important? That you want to understand. What is the importance in the field, in the specialized thing? Cardiology, neurology, nephrology, gastrology. Everywhere is a specialized diagnostic techniques are available. There is a identification or there is a clinical evaluation is required. If you are not understanding clinical evaluation, then how can you go forward? There is a general. In your exam also you are writing. What curriculum. Sorry, in your exam. So why you are not utilize that in your practice? See, in exam you are writing as per New York Heart Association and as per your American College of Cardiology, there is a protocol. There is a total pharmacotherapy management is given. And when we are asking, you don't know what is the main medications we want to give when patient is coming with congestive cardiac failure, or patient is coming with a heart attack, or patient is coming with the acute left ventricular failure. No, don't know, because you are bookish. You are keeping everything related bookish, writing in exam, forgetting everything. But in the clinical pharmacy, I will say you want to be updated daily basis. Like a physician, as I am with the physicians, they are keep updating them daily. And it's not going to happen by one day. It will take 5 years to understand that thing. Keep it in your mind. As a family, you want to be grow very fastly, because we have very less time to introduce in our end. Otherwise, there is a lot of options came in the market where your position is grabbed. Okay? Then I will not go with the all specialties, but this is the main things I want to tell you. Understand it and keep it in your practice. Various ambulatory services. Yes, I already said oncology. Yes, there is a, I don't know, but I think so you are heard about Oncotherapeutic Fellowship by Tata Memorial Hospital. And it specialized eligibility they give MD Pharmac or PharmD candidate, whoever 2 years of experience. What is your work there? You know, it's an ambulatory service. But why we want to do, what is there, why is important or not? For research, do research on its importance. There is a lot.
Yeah, you continue.
I
Sir.
am. Okay. I want to tell you, patient data right here from all the facts. Drug-related problems can easily be eliminated. As a healthcare professional, there is no difference in a clinical pharmacist, clinical pharmacist, and hospital. Hospital pharmacist totally looking for the budget and everything. Clinical pharmacist look into the total clinical related things. Be clear with that. Saying that you want to do that thing, this thing, that thing. Yes. Improve your curriculum, because you have a chance to improve your knowledge by every aspect in the healthcare. Okay, so keep learning, but don't be keep that thing in your clinical practice. Your clinical practice will be related to clinical only, not to be in the hospital. Hospital pharmacists have a different role. Hospital pharmacists have their own role, and clinical pharmacists have their own role. Don't conflict with both. Be thorough with and be clear with that. Don't conflict with each other. Okay? Because clinical pharmacists totally involved in their clinical practices and critical care will be backbone of the physicians or in consultants. Okay? And hospital pharmacists is the services where the drug purchase, maintaining the formularies, waiting ROLs and a lot of things are there. That is not our look. Our look is only effective and safe drug to get to my patient. That is on time. That is your look. Okay? Then we will go next to the clinical service without clinical pharmacy and clinical pharmacist. Most of the drug related cannot be easily eliminated. Why? In the most developing countries, because I am not saying in India and other, I will say take a developing means Nepal only, our Nepal. Physicians are mostly incompetent from their training players, nurses like careless, pharmacists don't know anything about the compromised training packages, healthcare. The same thing is India. We are not, because they are our neighbors. So neighbors are learning from neighbors only. So keep keep it in that mind. So we are also in same phase. So how we want to develop, that is in our hand. Okay. So this is the one slide, as I can say, here you want to concentrate for your practice. Medicine is for those who need them, not for those who want them. That is most important. Psychiatric cases, or you can say drug addicts. You must want to know about you, to whom you are counseling, or to whom you are getting touch with related to therapy. That is most important. Who's required? Yes, give them total knowledge related to. Who don't require, because in our friends, circle, community, lot of people are coming. You know about the medication. Can you tell me about this? That is not our practice. Our practice is the professional practice, where you can say why you want this information. For everyone, is we are doing or not, because I am doing this monitoring also, because I know the physical examination, clinical evaluation for the patient, and I learn from the physicians only. Be clear, learn from the physicians. Don't give your bookish talent or Google talent in that. Okay, there is a diagnostic techniques are different. Okay. Then essential components of pharmaceutical care is the pharmacist-patient relationship, pharmacist work of drug therapy and drug data collection. Already we gone through that. I'm not going with that. And the explanation related to core of pharmacotherapy plan, conditions of patient needs, outcomes or desired conditions, regimens and the achievement. And there is a prime, that is for pharmacotherapy problem. Core is for pharmacotherapy plan. Prime is for pharmacotherapy problem, that is pharmaceutical based problems, risk of patient interaction, mismatch between medication condition patient needs and efficacy. This you want to follow in your practice at the time of intervention. As I know there is everything available in your curriculum in the PharmD. Documentations also we know related to pharmaceutical therapy. Here is the clinical skills of pharmacist role in pharmaceutical care. Can I want to go in that, sir?
Yes, sir. You can, sir.
Yes. So there is a education and counseling based skills. I will concentrate on that. Sorry. There is an interview skills. Interview skills in the sense of patient interview skills. We are learning in the patient interview skills, but how we are approaching to patient, that is most important. Just you are going to patient and directly saying, sir, you are taking these medications, or in your community also, besides your home, someone neighbor is coming and you are just approaching him, your friendly type. That is not professional practice. Be professional. Introduce yourself by professional. Keep an interview skills. Ask continuous questions to the patient. Then only give the answer. See, when we are going to community, there is a lower class people, middle class people, upper class people. Upper class patients, not people. Lower class patient, you can say anything, they can accept it. Middle class people, they will think something. If you are saying anything, they will think and then they will apply. But upper class, they will already coming with the googling and everything. And that time, as you can say anything, they will start their own. Okay? So here you want to understand your interview skills, understand patient condition, understand what they know, and approach like this. Don't approach just by simply, sir, this is the medication. In counseling as law, we can say, just you are going and, sir, you are taking this medication for antacid, this, that. No. Introduce yourself, ask question to patient, how are you feeling, what you are taking for your care, are you know about that thing. If patient is saying, yes, I know about it, may I know what you know about your therapy. In that, if you you are more known about that, because I am sure that patient don't know a lot of things, then go forward. Then go forward and start your counseling. Don't go just basic concepts. Okay? Communication skills, yes, listening, speaking, already I said, writing, patient level understanding, ability to motivate and inspire. That is most important. Because patient is sick and you are going and giving the counseling to that patient, and you are saying, sir, you are taking this medication for your health, but this is a side effect of that drug. So be careful for that. So what is happening? You are inspiring, you are motivating that patient, or keeping in the fear. Be clear. What we want to tell, that is most important. Give a counseling according to that patient can inspire or patient can get motivated. Okay? Because lot of diseases are there where patient can get proper counseling for motivational or inspirational counseling, then they will come up with good care as early as possible for their health. Okay? Then develop and implement patient education plan based on initial education assessment, then identification results, compliance barriers. Patient-specific pharmacist care plan based skills, recognize prevention, management of drug interaction, pharmacology, pharmacotherapeutic, interpretation of lab tests, knowledge and community resource. These all things, I think you know everything regarding this. This is one slide where I want to tell you about aims of pharmaceutical care. What is the aim? That is main is effective drug therapy. If the patient takes the therapy properly, safe drug therapy. Is safely protocol he is following when he is taking the medication. Safe drug therapy in the sense that his patient is not getting any other side effects or any other drug related problem because of therapy. See, everyone knows that paracetamol. What is the side effect? Burning, methylation, or what other things. And the same time we are giving to patient tablet pantoprazole. It is a therapy. Pantoprazole will do this. What is pantoprazole? I can't ask that. Everyone knows these things. So it is a therapy for that patient. So it's the same drug therapy. It's not that इसके कारण burning methylation हो रहा है, so I want to stop. Already paracetamol want to give on SOS only if fever. But we will see the patients who will take a continuous. What is the major side effect? Renal failure. We know that, but still we are not counseling to patient. We are not giving a counseling or telling to patient, because we are a pharmacist. Doctors will take care for that. How we are, and our healthcare system is not allowed to talk with patients. Why? This is all questions to everyone. Okay? Economic of drug therapy. Can you involve in that? Question mark. Can clinical pharmacists involved in economic drug therapy? Is healthcare system is accepting that? Up to me or up to healthcare? Are you involved? Question mark. Economic drug therapy, because this is a pharmaceutical care where a clinical pharmacist is involved. Economic drug therapy in the sense you want to give as per patient condition in the sense financial condition. Is a poor patient, is a rich patient. I am not saying a difference between poor and rich. Patient is patient. But we want to understand his condition also. Otherwise, we are giving very high dose, and after that, for 4-5 days, patient don't have money and he will not able to give medication. So that is a lookup of your practice also. Clinical pharmacists can take care of that also. Then last is improve the quality of life. Quality of life is not just the thing where you can just counsel the patient related drug therapy. We want to understand the patient conditions also. How he can improve his quality of life. It's not just a dietitian role or physiotherapy or lifestyle modification and that's it. It's our main motto also. You want to keep involved in the diet, keep involved in the physiotherapy, keep involved in his daily activities. What is his workflow? What job he is doing? That you want to understand, and then only you can give counseling. Then only you can give a best quality of life to your patient. Okay, understand. Then a case simple. I will just give you an idea how you want to see a case and what you want to understand. There is a 44-year-old lady, fever and green sputum in the cough, no from previous medical illness. Diagnosis is a upper respiratory tract infection and prescribed with co-amoxiclav, like amoxiclavolate, doxycycline, prednisolone, theophylline, omeprazole, metoclopramide, solvent. It is required all medication. question mark for the consultants also and for patients also. Because while looking the medications only patient half got fear. This many medications I am taking means how much I am in the very critical condition. So this is our work where you want to ask your questions. First is pharmaceutical problem identified. Common organism for upper respiratory tract infection for the selection of antibiotic. Is it required or not? Empirically started, then how many days it started? Is this patient is in asthma? Risk versus benefit. Understand it. Why the theophylline is started? Why the prednisolone is started? What is the salbutamol? Risk and benefits. Understand. Need of acid suppression. Required omeprazole metoclopramide. Why is she is nauseous? Because of medication side effects? Question mark. Benefits of bronchodilation. Is it required to that patient? Question mark. Does she know what to take? Will she take it? That everything is a pharmaceutical care. That you want to ask question to yourself and to give best therapy to that patient. Okay? This is just a question that you want to keep in your mind when you are doing a pharmaceutical management or pharmaceutical care for the patient. Think of someone in your family, a friend, or just something go wrong while their medication. Do start with your family. I will say in my every lecture, if you are not going to expose yourself in the community or in the healthcare, go start with your family or your friend who will known to you. Okay, if they are getting any problem, so go start with your family, counsel them, understand their therapy, understand their conditions, counsel them. Then when they will go to the community, they will say to their friends, they will say to my son or my friend will told me this thing very nicely, and after that I will got cured within 2 days. Then next time when that patient is starting some medication, he will come to you. I will go to the doctors and I will got this medication, but I am not getting relief on that. So will take come to you and you will start your practice on this manner. So you are known and you are recognized to everyone. This is most important thing. Okay. So here I will just question that I told you cause and adverse unwanted effect at medicine stop when should have continued, not work, what happened, could it be avoided, whatever it may be. It's all questions you want to ask yourself. Okay, yourself in the sense you want to ask the patient or relative what is actually he done, that's why he is suffering, and then start your counseling to that patient. This is a first step where you can introduce yourself in the community. There is a lot of things are happening in the market. Doctors may pay less charges after drugs, and the teenagers die, this Hyderabad and that. I think you heard about everything. And next this whole, after this all, as question is coming, so drugs are safe. Community don't know. As we know, we are saying, sir, medication, clinical pharmacy, and everything. We know drugs are not safe. Drug, how to give, how to take, no one knows, but everyone is taking, and these things are happening. Can we avoid these things? Why we are introduced in the healthcare system? Because of this thing. We know this thing, everyone knows. Healthcare provider also knows. But sometimes even they have a high workload, and they will just keep the patient for diagnosing this thing. Patient is not given correct, not taken the correct past medication history. So this thing will happen to patient, but the doctor is curing the patient by his symptoms, not looking the patient past medication. And that is the current scenario in the healthcare system. Here you are the most important person. You want to tell to healthcare providers, please collect past medication history, that we can say reconciliation. Okay, involve healthcare people in your practice. Okay, these things will happen because of medications will take wrongly, human errors, mistakes, clicks and lapses, sources of errors, everyone knows, prescribing, subtle administration disorders. Then 6 types of problems is the result treatment failure. Selection of medication, formulation of medication, administration of medication, medication taking of behavior, monitoring of drug therapy, response of the drug therapy. This everything thing you want to look into your file and you want to find out where is the failure, because of clinical or because of medical therapy. And this is a clinical box role where reducing a risk at time of admission, at the time of formulary development, at the time of established protocol development, allergy, prospective review, administration instruction, clinical pharmacy services followed or not, and drug distribution system. Relate everything to reduce the risk to the patient, because this is the opportunities of error, whereas patient will suffer and no one understand what is happening to patient. So when you are assessing a case, you have to keep this everything is in your mind, what is actually happening. Okay? And where
Deepak
we
sir,
are important.
Deepak sir,
Yes, sir.
Oh.
So patient,
Go ahead.
hello?
Go ahead, sir. Go ahead, sir.
So patient assessment questions, does the patient need the drug? Is the drug is the most effective and safe? I will not go with the more, everyone knows that we will directly turn up into our question session because it's already over. So anyone have any questions, or I will share my experiences where the clinical pharmacist role in the healthcare, where we want to be introduced ourselves by our own effort. Okay? We are not the frontline persons until in the healthcare where we can't keep our steps beyond services. Okay? So I request to Ramara sir, if anyone have the questions, we can go forward with that.
Yeah, now you can unmute your mic, sir.
Yes, sir?
You will unmute your mic.
Yes.
We'll see. Yeah, participants have unmuted your mic. You can interact.
Hello.
Yeah, it's audible.
Hi everyone.
Participants,
Participants, is there any questions?
Soumya,
If anyone have any questions, please ask. Otherwise, I will think that everyone is understand everything what about we are doing in the practice, because this is the visual platform where we can't elaborate a lot of things in the practice. I want to take you in the actual practice where we can conduct other sessions also day by day. There's no, but I need a questions if you understand what we are actually doing.
participants, please unmute your mic. I have permitted you. Durga, Gayatri. Is there any technical problem? May I know?
Actually, they are not understanding. I think so. How to?
They well understood. Means what they are accepting what you said, what you explained. They're obeying by silently. So we have to do all these activities.
Okay.
Divya, Jai Divya, Bhavani, Mahesh Reddy. Hello, participant. Is it audible to you? Please say yes or no. Hello.
Dear participants, please unmute your voice. Is there any question?
Participants, are you there?
I think so. There are questions for participants, and I am happy to give the answers.
It is going.
Shenu Gaikwad, Jyotika, Rajni, hello.
Hello. Yes, sir. It is audible.
It is audible. Is there any questions?
No, sir.
There is a cleared clinical pharmacy services. Hello.
Hello.
Any questions? Anyone have any questions? Can we go forward? I think so. I tried to cover, but because of the disturbances in the current and everything, I thought that there is a chances of understanding. So
No,
if you
you have
are
covered well. You have got very well said, but some technical problem happening both sides and student side too. So students,
because I think that there is a lot of questions must want to come because there is a lot of questions in your minds. What is actually clinical pharmacist will do? There is uh, no acceptance from the patients, from the healthcare system.
yes.
This is not
No,
just only the
participants, what is the problem?
Rajnikant, Naga, Tejasvi. Is there any
Nagasri,
question?
even I have permitted all participants to unmute.
Okay. Where is that?
Yeah, my side, as a host, I can do, sir. I permitted unmute them. So even Jyotika,
This is not session only for the participants. I will request to the lecturers also. You can ask your doubts if there is anything that you want to know. Because I will really thank to my lecturers also who will give their efforts to teach us. But something is there that we want to understand for the clinical services, which will different from our academics.
yes.
Yes.
Yes, sir. Rajnikant, sir.
Sir, good morning, sir.
Good morning. Why don't you
Good
interact?
morning.
In between, small work was there. I am there.
Yes, sir. Yes, sir.
Your presentation is very simple, sir. We read it in a very lucid style.
Yes.
Yeah.
Students,
Sir, Ramana,
Actually,
if you are in lockdown, this is the time to where you can motivate yourself, where you can boost yourself, you can communicate such a personality. Even Saturday also saw work well in hospital. He came at 8 o'clock. Even he took some guidance for how to log into the Zoom. But again, Sunday he wants to take rest, but even though he's spending his time for us. Yeah, Swapna Mumbarti. Yes. Yes, Swapna, you can.
Good afternoon, sir.
good afternoon.
Sir, thank you, sir. Thank you for overall introduction and everything about the clinical pharmacy in India and what we are doing in the settings. Sir,
Yes.
here we are facing a problem with, even though when we report the errors in the hospital, they are not accepting, sir. Even to the physician and in between the physician and nurses, we are being stuck up.
Yes, yes.
So
This is
in this
actually,
situations, how can we overcome that type of situations?
yes, so thank you for a good question. This is the most important question in our practice because there is continuous conflict with the doctors and the nurses. As I can say in my 5 years career, I am a enemy of RMOs also and the doctors also in this matter. So this is a good question for me also because I am also a over up with this problem. See, when we are finding a medication error or adverse drug reaction or anything, and that is not accepted by the consultant, we don't want to stop. We have a reporting system. We want to do a reporting system where we are allowed in the what we can say pharmacy and therapeutic committee meeting. Okay,
Yes, sir.
so there you want to keep this your errors in front of the management or in front of the other healthcare professionals. He said this is the things will happen, and we are in the more lack in the practice where we want to overcome with the improvements. Okay, and this is the main thing you want to understand. Don't be in inflicts with the nurses and the doctors. Be
Okay,
clear with that.
okay,
Okay,
sir.
if they are not accepting, not accepting, this is not your matter. You are a person, clinical person who will get the right way to the physicians or to the nurses. Keep reporting. Once you can say, second time you can say, third time you can say, they must want to accept it. If they are not accepting, reporting in front of the management, tell to management, sir, this I can found, but no one accepted and this thing will happen. Same thing has happened with me also. I will share my practical experience. One of the organization where I am working, where the same thing has happened in the organization, I told to the consultant, sir, don't give this medication, patient will get problematic, patient will get die.
Yes.
But no one heard regarding this thing. No one heard me, and they are continuing with that medication, and after 3 days of that patient got death.
Yes,
There
sir.
is not respect for me, not respect for my profession. But I have not got disappointed. I continued my practice on the way. I told them, after that they came to know that cause is that related to drugs only, and I already said thing. After that automatic our importance is got increased. Yes sir, Dr. Deepak sir said this thing, but we are just ignored. Okay, so one
Yes.
time they are ignoring, second time they are ignoring, third time they are ignoring, but one is the time is coming where no one can ignore you, and they will accept what you can say.
Okay, sir.
Okay, so
Okay.
keep reporting to your system. Keep a first create a system. Okay,
Okay, sir.
when whatever you are capturing, keep it in, prepare a Excel sheet and keep it in that, and report it to the quality department, report it to the higher management, and keep
Okay.
efforts to introduce yourself in front of the healthcare. If nurses are not accepting, physician is not accepting, so here is a lack of our practice. Okay, when you are going to them and saying that this is the error, you want to go with evidences.
Sir, even with the
In my
evidences, they are not accepting at all, sir. We must be think at a therapeutic level. They are saying so many reasons, sir.
So yes, so here you want to tackle the problem. You are
Yes, sir.
understanding? Here we want to tackle the problem. We want to be go through with basics.
Okay, sir.
First listen them. First listen them. What they are saying. We don't want
They
to
have
fight
been
with.
there for so many years. They have been there for so many years. Just
Yeah,
we
yeah,
have
yeah,
come.
obviously. Obviously, sir, they are. See, I work where the organization, where the doctors, physicians is coming from out of India. They learned a lot. They have 25 years of experience. They have a gold medalist. I
Yes.
work with them. In the first 6 years of my every institution, 6 months span, it's a very bad span in every organization where I'm not accepted, means where the organization or healthcare doctors, physicians, workers not accepted me, but I am not left them. I keep going, keep telling them, sir, what is their practice? They are a gold medalist, good on their place. What is the practice I want to follow? I am working for the patient care, and that is a role defined, and it is my job responsibility. And I am
Okay.
working for the organization and I'm working for the patient care. So keep reporting them. If they are not accepting, telling them, uh, go with evidences. Still they are not accepting. Take more efforts to
Okay, sir.
do a research study of case.
Right, sir.
First clear your concept. First clear with your total theory, basic concept, thorough with knowledge, and go in front of them. Same thing
Yeah.
I done in my practice. I gone first time. I am not gone with just simply saying, sir, this is a error or this is adverse regression. This is a problem to facing a patient. I will go on thorough with the case. I will study that case for 1 day, and the second day I went to the doctor to saying everything evidence based. And if he is not listened or he is not accepted, what I done one monitor, one my protocol I done. I kept that mail to the all our organization by keeping CC of higher management.
Okay,
What
sir.
is
Yes, sir.
happened? This is your confidence. If you are confident and if
Okay.
you are professional and if you are working for the uh, healthcare and if you are working for the patient care, you don't want to compromise your knowledge.
Yes, sir.
Okay,
Yes.
and if you are correct, keep your everything in front of them. I
Thank
kept
you.
that mail to, and then come up with everyone is came up to me and asked me how you kept the mail. Are you understanding patient condition? Are you that? I told, sir, I kept all evidences in that. That is your decision. This is just my suggestion. If you want to follow, follow it. Otherwise, leave it.
Okay.
But my work is that.
Yeah, sir. One
Okay.
more student is waiting. Gopi.
Thank you,
Gopi.
Swapna. Are you clear?
Good afternoon, sir. Thank you for your nice lecture, sir. And
Yeah. Gopi.
He
before
is
you
one of the
said,
active students, sir, in our hospital. He's a formed intern. He works well. He
Okay.
spends his most time in gynecology. He is passionate
Great.
towards the patient.
thank you, sir.
Great.
Sir, my question is, um, before you said we have to show some evidence to the physician, no, sir. Here we are having the three types of resources, no, sir. Primary, secondary, tertiary. In
Correct.
hospital, which type of resources are widely accepted, sir?
Correct. Yes, Gopi.
Sir, we are having the primary, secondary, and tertiary resources, no, sir.
Yes.
Uh, Mostly accepted resources is which one, sir? Either primary, secondary, or textbooks, tertiary.
See, when you are going for the resources, you want to go first, means by your knowledge only. Okay. Primary
Okay.
resource you just want to follow because it's a theory, basic concept.
Okay.
Okay. But
Okay.
go with your problem. First, understand your problem, then find the resource.
Okay, sir.
Otherwise, you have a error or you have any clinical study and that you want to find in the research papers, that is a tertiary research, internet and all, and where you are keeping in the Google simple language, I want to find acute renal failure therapy, and in that actually you want to find what is the problem for that patient. If you are understanding a case, then only you can find a proper resource or proper evidence. If you are searching just generalized statement, you are not get your answer. Just understand that thing. If you want to give proper evidence, then you want to understand first your case, what you want to, and what you want to give to the physician, or what you want to follow, or what you want to refer. See, primary resource we can say books and or articles, means bookish articles. But we will say we don't have much time. Obviously, we don't have much time, but we want to follow the protocol. Secondary research, and in that also I am saying return. In that also you must want to concentrate what actually you want to search. In my interns, there is a interns came under me, and related, means I told them one case I gave to them, and I told just find out the reasons or cause of the condition. So they are keeping general statement in the Google. They are not gone with primary, secondary, they are gone with tertiary resources. And in that they are keeping general condition of that patient. Array, what actually you want to search that you don't know? How can you go with evidences? So this is only the our searching criteria. What actually you want, and if you have a books, go with books because that is the primary. And if you are thorough with the basic concept, go directly with secondary and tertiary references.
Sir, I have one question, sir.
Yes.
So even if in COVID pandemic, what you suggest, most of family guys are enjoying at their home.
Yes,
due to
yes, yes.
panic, due to even in COVID pandemic.
Yes, yes.
So their panic and some parent leanness, and they're taking rest at home. They're not working as before. So what you suggest them means, is it correct? Being family guy, intern or 50 years students are mostly they are staying at home and they are attending the online classes. Our students are attending online class, even they are doing internship, but most of things are not happening as before. But what you suggest?
Sir,
Being
my
a
suggestion,
brother, being a senior, being a professional pharmacist, I know your experience because the passion towards the profession.
sir,
What you
it's my
suggest all family guys throughout India, I'm saying,
no,
because
no, no.
it is a course has introduced it for upgrade ourselves along with B Farm and family also came out such a way that the students are not passion, such a passion, but there are some students like Gopi, Swapna, some Sunananda, some students are there. There, I'm sure in out of 30, there are 20 members are working fine. But some even the natural calamity also pandemic students also making problematic.
Sir, this is a very important question nowadays because I will say yes, there is a pandemic conditions, but here we have a chance to introduce ourselves.
Yes.
This is a big chance, very much big chance. There is a farm D can introduce, and it's not. I'm saying don't depend on the governments and everyone that they will allow you and then you can start your work. I think there is a PCI notification also. You can utilize your nearby hospital and give a service if you are an intern. Don't stay at home. I am last 3 years onward. Where is the first patient introduced? There is a what Philippines patient came to Hiranandani hospital. That time I am in Hiranandani. We don't know that is a corona patient. Till date, I am working in the corona pandemic situation. Daily, I am going to healthcare. One day also, I am not at home. One day also, only Sunday, that is a week off. That's why I am at home. But daily, I am going and I am giving a service. I am doing a therapy protocol. Even I am involved in the reporting systems also, reporting to the government, doing a research, ICMR researches, clinical trials related to pandemic situation corona. How do we want to manage? Keep your efforts to give a therapy protocols, give a knowledge to the physicians because they also don't have any choice. They are doing their work, management, clinical management, but therapy management is our part. Take a part and go and give your knowledge, give your knowledge, give your practice, and follow the protocols. I will not say to anyone to stay at home. If you are staying at home, do a research, do a review what you are learning in your fifth year of pharmacoeconomics and research. That is most important because there is a lot of things no one know what is actually happening, what we want, how we want to cure the corona disease. There is patient cure rate is too high, but it depends on patient immunity. It's not because of therapy management. Okay, so I will say to all interns, don't be at home. Go and directly involved in the healthcare system and tell them, sir, give me the any responsibilities. I can really interested to do these things. And yes, there is no one say you don't have any work. There is a lot of works in the healthcare system nowadays. They require everyone who is understand the clinical conditions. Everyone, huh? I am saying if there is a compounder also, but he have 15 to 16 years of experience, they will take them also for a situation handling. Okay.
Okay,
So it's
thanks.
my clear advice to all PharmD interns: don't be at home. And if family is getting fear, you know, you are going and you are getting a corona. Okay, if you are following proper safety techniques,
Yes.
I'm saying clearly, if you are following your proper safety techniques, it's for you. Okay, don't think that there is a healthcare professional, they are not following. You want to be strong, you want to be careful, then you want to be follow the techniques. I am daily going, my total face and everything will be covered because I am going to the healthcare, and even in my home there is a 1-year-old child. My daughter is there. I want to take care of myself also and my family also. And I can't stay continuously 24 hours at a hospital. Okay. So it's my care. When I am going, I will be full packed. I will be taking care of myself, but I am providing a service to the healthcare system. That is my passion. It's not that you want to stay. It's not that I am employee, that's why. Because for employee also they will say you can stay home, you can work from home. But it's my prime work that I want to introduce myself. I am also important in the healthcare system in this pandemic situation. And I can't stay home. I can't. I want to give my service to the patient. So why I want to be stay in home? And as an intern, this is a chance you can introduce yourself in front of the healthcare system. I will say you can go and you can keep learning also. You can update yourself also in this pandemic situation and spread awareness to the community also. What is actually they want to do? I'm getting daily 20 to 30 calls from the relatives and from the other people who will say, sir, means my relatives, and they're saying we are facing this problem, that problem. I am just giving them a counseling. I'm spreading awareness because this pandemic, everyone has got a fear. What is there is no thing related to fear. If we can
Yeah.
say there is a police workers working, there is a social workers working, there is a healthcare workers working, there is all government sectors are working. So they don't have fear. Why they are working? They are working for the healthcare.
Sir,
They are working.
unqualified people are working for the public, sir.
Yes, sir.
Yeah, unqualified people are working for public.
The public is not following. That is not. You want to follow your care.
Yes, yes.
Public is in their place. Public is not following. That is not your hand. What is in your hand? You want to take care of yourself and you want to give a service.
Yes, yes.
If you are running from that, then you are not useful for healthcare system. You are not understanding your purpose. And as academic, I will say PC and everyone is saying academics you want to conduct like this, like that, like that. Yes, you want to conduct. There is a facilities are available. That's why you are conducting. But what about your practice? How can you are introducing yourself in front of the healthcare? How can you are introducing in front of community? Even in the time government is required, and that time also we are in the dilemma that we are not getting exposure. And now is the time you can get exposure. There is a Mumbai, there is a lot of interns they are got. There is a they gave Yota.
Sir,
Corona
one
hai
more
Yota.
thing ready to ask.
Yes, sir.
Yeah.
Yes, sir.
Yeah, she's asking. Hello. Hello.
Yes, yes, I'm hearing.
Sir, I'm Swapna. Sir, I want
Yes,
to
sir.
know something, some information regarding our upgradation, sir. Sir, I want
Yes.
to become a challenging and unique clinical pharmacist like you, sir. So, but
Okay.
it's a bit challenging in this type of situations and everything. So, in order
Yes.
to come and become a unique clinical pharmacist like you, will you suggest something that is mandatory by the end of this family, sir? Or and
Okay.
also some courses which makes me unique from others.
Okay. 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 So, what actually unique in the sense? What is your definition for unique? Swapna? Hello?
Yeah,
Sir,
Swapna.
What is your definition for unique?
unique means I must be different from the other clinical pharmacists who are at the same level of me.
How? How?
With my
How?
skill
How you can?
or the extra skills which I must have in case of
See,
patient safety or anything in the pharmacy related.
so your question is that how can you unique or how you want to become a unique?
I want to become an unique, sir.
See, first of all, first we are in the infancy stage where you are not thinking about the unique clinical pharmacist. We want to be a first important a clinical pharmacist or a pharmaceutical care specialist for the healthcare and for the patient care. Unique you will be then when you are keeping your all efforts and you are be recognized by everyone. Then only you are become a unique. By profession, by specialties, by doing higher educations, by doing this, that is not a unique clinical pharmacist.
Okay,
First
sir.
thing, clear this thing in your mind.
Yes,
Unique is not the definition, or unique not the that you can get is by specialization, by keeping the practice, because all practices in the place. But that following or not following, that is the important. Western countries already 40, 60 years back, there is a clinical pharmacist.
okay, sir.
Till that there no one is a unique clinical pharmacist. Okay. So
Okay, sir.
in India we are in infancy, so unique is not the definition. You want to introduce yourself by differently, that is you can say unique.
Okay, sir.
Unique see, introduce different than others means is not that ki you are starting something new, because there is nothing new in the world
Yes,
in
sir.
the clinical pharmacy sector, because we are doing a lot of processes by copying Western countries. We are not doing any unique thing or any unique starting. This is I done. This is my thing. Okay. There is nothing in my thing. There is everything is already placed, but we are not following that. If you are following that and you are keeping that upgrading, you are keeping a steps to upgrading that, then you are becoming unique. Yes, this is the process and I upgraded that thing. And you are unique for that one organization or that one institution, not for the world. Okay. So now there is a clinical pharmacist working in NASA. So she can say I am a unique clinical pharmacist because I am working in the NASA. What is the role of NASA for as a role of clinical pharmacist in NASA? You know,
No, sir.
till that there is a clinical pharmacist working in NASA.
No, sir. Just now I
Uh,
come to know from you, sir.
so there is a clinical pharmacist job in NASA also, and there is a one PharmD candidate who is the most senior person. She is a head in one of the department, and she is a clinical pharmacist. And in NASA aeronautics,
Yes, sir.
okay, aeronautics clinical pharmacist, that is also special, and she is a unique. That you can say unique because she won. But now there is a place. There is everything is placed. She is following that. We are not following that.
Yes, sir.
Okay. And there is a lot of clinical pharmacists. You can't say that I am different. You are keeping upgradation, then you are different. Yes, we are done this. We are separated. We are specialized. Okay.
Sir,
You
is
are
it like
special.
any particular specialization in any area, sir?
Yes.
Particular specialization like if the particular student is specialized in the cardiology and neurology.
Yes, sir. Till India, there is a nothing. Is right specialization. But in out of India, yes, there is a specialization. Everyone knows that thing. But in India, as we can say, we will do a practice as a specialized.
Okay.
Okay. there is a course is not available. But if you are keeping your efforts in front of the specialized physician who is working from last 50 to 20, 25 to 20 years in the field, like I can say, in the my previous organization or in the my practice, I am become a critical care clinical pharmacist. I am become a neuroclinical pharmacist. I am become a metabolic clinical pharmacist. Sorry.
Okay, anybody else?
So it depends how you are approaching, and that physician or that team want to accept you. See, when Fortis Hospital they have started a heart transplant, so that time I am a transplant clinical pharmacist because I am monitoring the transplant patients only. So the team want to accept you. Yes, this person is have thorough knowledge with the therapy management, so we can take him in the specialized field, not in the all fields. And that will happen when healthcare system or physicians will understand your value.
Okay, thank you, sir.
Any more
Thank you, sir.
questions?
So, anybody else?
I am here. Sir, YouTube is also on.
Yeah, YouTube is also coming.
Okay, okay. Any questions? Gopi? I think there is a hand raised. Swapna is okay. Sudhir Mandela guest. Okay.
Hello.
Gaurav?
Yeah, Gopi. Why not other students?
Gaurav Damdar. As I can see, there is something.
Yeah, Gaurav Damodar Gayatri.
Then Gopi is
Please
hand
raise
raised.
hand. I can give you unmute.
Sudhir?
Sugriv. Yeah, Sudhir. Sir, please stop share PPT, sir.
Yeah. That's only I am searching how to stop.
Yes, there is red color stop button is there. Stop share.
Okay. Stop recording in there.
Stop recording, not stop share.
Stop share is
Stop share.
okay.
Yeah, you clicked on stop share. Just
Stop
click on
share,
stop
okay.
share. Yeah, now you have come on screen.
Yes.
Yeah.
Sir, any
Yeah,
questions from your
participants.
lecturers?
So am I audible, sir?
Yes, I am audible. Yes. Hello?
Yeah, it's audible.
Who is there?
Hello?
Any question?
There is some net problem, sir. Yeah, sir.
Okay.
I think you have satisfied. You have given more information. You have boosted our students.
Thank you. Thank you.
With your experience, even I think you have been working last 4-5 years, sir.
Yes, I completed 5 years in only clinical pharmacy services.
Yes, 5 years experience with different corporate hospitals.
Yes, different corporate hospitals.
So thank you, Dr. Deepak Bombay. With small relation made with big effort to our students. Really, we are fortunate to you, sir, by saying your experience and your practice.
Thank you so much. Actually, I really appreciate the Chalapati students because they have a thorough knowledge. Uh, when they came under internship under me, I just saw their thorough knowledge in the field. If they are keeping that everything is in practice, they will do miracles.
Yes, sir.
But there one observation also I want to say, uh, be professional. Be professional when you are doing a practice. Okay. When you are going for the rounds on the internships or anywhere, keep it in mind, we are a clinical pharmacist, not a doctors. Okay, we are a clinical pharmacist to support a healthcare team, not a doctors to oppose to the physicians. Okay, so this one of the line from me to all PharmD students in all organizations.
Okay, I hope student can understand. Okay, thank you very much, sir. Thank you, participant. Last but not least, which is most important to participants, you have to click your feedback link for this webinar in YouTube link. There is below this description to receive your greeting at our respective mail ID. Really, we had a wonderful session today, where a PharmD student like Deepak sir worth and work proving such a corporate hospitals. It's appreciated thing. Sir has awarded so many times. We need all PharmD students should work like, should become motivate and participate in all clinical activities, even in COVID pandemic. Thank you very much, sir.
Thank you very much, Dr.
I hope
Ramarao
all
sir.
you will click the feedback form. I'm expecting you to attend the future sessions. Please interact with the all speakers, all sessions. Then only you can upgrade yourself. Thank you, Deepak sir. Thank you for participants.
Thank you, participants. Thank you for Chalapati Institute for Pharmaceutical Science for giving me this better opportunity, virtual opportunity to talk with you all. You can be connected with me anytime on my contact number, which will get from the Ramarao sir, and also my email ID also. If you have any doubts, you can continuously contact me in any time. I will be available for guidance and for practice. Thank you so much. Thank you so much for giving me this chance.
Okay, I'm expressing your sincere shout-out and make a veterinary principal Professor Ramaram and management Vaivanjali Garu provide such a webinar facility not to stop our continuous education to our students, even we are in COVID-19 pandemic situation. So our students are very fortunate to have you, sir. So we are expecting further field sessions. Thank you, sir.
Thank you, thank you, thank you. Can I leave?
I'm in the session, sir. I'm closing the session, sir.
Yes, sir. Yes, sir. I am also leaving. Thank you.
Thank you very much.